Get Well 101. And we talked about prostate cancer screening in our first broadcast in the morning. And because of many of you who were probably at work and couldn't have time to tune in to watch the live broadcast, we promised ourselves that we will go back again and repeat the broadcast again, just for the sake of those who were not present during the day. Do not forget that we in Gateway 101 we place this emphasis on prevention because we strongly believe that prevention is better than cure. And we strongly encourage you to go for your screening. We also encourage you to go for your doctor appointment. Encourage you to go for your routine checks, for prevention is better than cure. We also have a lot of home remedies video in our YouTube channel that you can watch that will be of great benefit and that will also help you. Okay, for prevention is better than cure. Okay, so we're going to be talking about prostate cancer today. We're going to be talking about prostate cancer today, and our emphasis will be on who is at risk and preventive tips that you need to know, when what to look out for, and also when to go for your doctor appointment. Okay, so we going to talk about healthcare awareness that we create in our community. Remember, Gateway 101 is the only uh, only YouTuber that actually volunteer to take you to your doctor appointment free of charge. We don't charge for that. Okay, we also create healthcare awareness. We do a lot of community healthcare awareness in our locality here. Okay, because we strongly believe that prevention is better than cure. So, without wasting much time, let's go and talk about what we have today. We said that prostate cancer is a type of cancer that starts in the prostate gland, a small walnut-shaped gland in men located below the bladder. Okay, the prostate help make fluid that nourish and transport sperm. Would you say that? I would say that most prostate cancer grows slowly. Okay, if you are joining us for the first time, please subscribe. Okay, like and subscribe, like and subscribe. So most prostate cancer grows slowly, but some can grow faster and spread to another part of the body. Okay, so what happened in prostate cancer? We said that normally prostate cells grow and divide in a controlled way. Okay, in cancer, some cells begin to grow abnormally and uncontrollably, forming a tumor. Over time, it may spread to nearby tissue or to bone and nerve nodes. So, who is at risk for prostate cancer? Who is at risk for prostate cancer? Prostate cancer is more common in older men, especially over age 50. Men with a family history of prostate cancer, men of African ancestry or African descent, Caribbean ancestry or Caribbean descent. They have a higher risk and often more aggressive form of prostate cancer. Okay, those with certain genetic mutations such as the BRCA1, BRCA2, they are at risk for prostate cancer. So, what are the common symptoms of prostate cancer? Often absent earlier. Okay, so early prostate cancer may cause no symptom at all. Okay, which is why screening matters. Please do not forget to subscribe and like this video. This is Gateway 101, okay, which is why screening matters. When symptoms appear, they may include difficulty starting or stopping urination, weak urine flow, frequent urination, especially at night, blood in your urine or semen when you ejaculate. These are early symptoms of prostate cancer. If when symptoms appear, this might show up. Okay, pain in your lower back, hips, or pelvic area, which also indicates a possible spread. Rectal dysfunction. Rectal dysfunction may also be linked to different things. This is why screening is important. Sexual dysfunction may also be linked to certain medication. It's actually certain medication can cause sexual dysfunction, and certain medical illnesses can or medical condition can also cause erectile dysfunction. So this is why screening matter. This symptom can also be caused by non-cancer condition like a large prostate can also cause all the symptoms I've just mentioned. So please like and subscribe. This is Gateway 101. Please like and subscribe. This is Gateway 101. Okay, so this symptom can also be caused, this symptom I've just mentioned can also be caused by non-cancer condition like a large prostate urinary tract infection. So this is why screening is encouraged, or this is why screenings matter. Okay, so how is prostate cancer detected? And doctor may use what we call a PSA blood test, also known as prostate specific antigen. Okay, that can be blood work can be done to detect that. Digital rectal examination (DRE) can also be done to detect prostate cancer. MRA scan can also be done also. Okay, please like and subscribe to this channel. Please like and subscribe to this channel. Thank you. And prostate biopsy. Prostate biopsy is done to confirm cancer. Okay, so what are the treatment options? Treatment options for prostate cancer depend on the stage and how fast it's growing, how far the cancer is growing. So active surveillance, watching slow growing cancer, might be put in place. Surgery, prostate removal, might also be prescribed by urologists and audiology. And radiation therapy may be prescribed by the oncology. Hormonal therapy might also be used. Chemotherapy for advanced cases. Okay, if cancer has spread, you may be put on chemotherapy. Okay, targeted or immunotherapy, some cases that might be used. So the key takeaway here, the key takeaway here is that prostate cancer is common, especially with age, and is often highly treatable when caught earlier. So this is why we place emphasis on screening, because we believe that prevention is better than cure. Please like and subscribe to Gateway 101. Thank you so much. Like and share, like and subscribe. Okay. So for those of you, for the 15 of you who are just joining this live broadcast, we're going to recap again. So let's go back again. Let's recap. Okay, so that those of you who are just joining can easily understand what we are talking about this evening. We are talking about prostate cancer. I will say that prostate cancer is a type of cancer that starts in the prostate gland. Okay, it's a small walnut-shaped gland in men, located below the bladder. Okay, so this prostate helps make fluid that nourish and transports sperm. Okay, so most prostate cancer grows slowly, but some can grow faster and spread to other part of the body. Okay, so I will say that what happens in prostate cancer. Normally, prostate cells grow and divide in controlled way. In cancer, some cells begin to grow abnormally and uncontrollably, forming a tumor. Over time, it may spread to nearby tissues or to bone and lymph nodes. Who is at risk for prostate cancer? I would say that prostate cancer is more common in older men, especially over the age of 50. Men with a family history of prostate cancer, men of African, Caribbean ancestry or African descent, they have a higher risk and often more aggressive form of prostate cancer. Those with certain genetic mutation like BRCA1, BRCA2. I will also say that the common symptom often absent. Okay, because early prostate cancer may cause no symptom at all, which is why screening matters. When symptoms appear, they may include difficulty starting or stopping urination, weak urine flow, frequent urination, especially at night, blood in urine or semen, pain in the lower back, hip, or pelvic area, which indicate possible spread. Cancer might have spread to other part of the body. Erectile dysfunction can also be a symptom of prostate cancer. While erectile dysfunction can also be a symptom of or side effects of certain medication, or can also be caused by non-cancer conditions. So these symptoms I have just mentioned can also be caused by non-cancer conditions like a large prostate. Large prostate have similar symptoms. Okay, and also urinary tract infection, UTI, also have a similar symptoms. So how is prostate cancer detected? The doctor might use PSA, which is test, which is also known as a prostate specific antigen, digital rectum exam, DRE, MRI scan can also be used. Prostate biopsy. Prostate biopsy is used to confirm cancer. Okay, so what are the treatment options? Treatment depends on the stage and how fast it's growing. Okay, active surveillance, watching slow growing cancer can be put in place. Surgery, prostate removal might be used. Radiation therapy might also be used. Hormonal therapy can also be used. Oncology might place you on chemotherapy, depends on how advanced the case may be. Okay, targeted or immunotherapy, some cases can also be used. So the key takeaway here is prostate cancer is common, especially with age, and is often highly treatable when caught earlier. Okay, so let us look at prostate cancer screening. Okay, when men should start screening for prostate cancer. Okay, that's a great question. When did men supposed to start screening for prostate cancer? Yeah, that's a great question. And honestly, this is one of those screening where timing matters a lot because prostate cancer risk changes with age and family history. Okay, so when should men start prostate cancer screening? Okay, most guideline focuses on starting a conversation with your doctor, not automatically testing everyone at this age. So at the age of 50, average risk, most men who have no symptom and no strong family history should start discussing screening around that age. Age 50, this is the standard starting point for men at tropical risk, mostly men of African ancestry. Yeah, this is a standard starting point for men at tropical risk. Okay, at age 50 or higher risk, age 45, age 45 higher risk, men should start earlier around that time. Age 45, if they have higher risk, such as a father or brother diagnosed with prostate cancer, especially if that relative was diagnosed before age 65. So if you have a family history, you can start at because you could start you can start testing or screening at the age of 45. Age 40, very high risk. Those who are at very high risk could start as early as age 40. Screening discussion may begin as early as age 40 if there is a very high risk like multiple close family matters affected at a younger age. Known genetic mutation like BRCA1, BRCA2, okay, and Lynch syndrome. You can start screening at the age of 40. Strong family history across generation. You can also start screening at age 40. What does screening involve? PSA is a blood test. PSA, remember, is prostate specific antigen. It measures the prostate specific antigen level, the PSA blood test. Okay, while the digital rectal exam, a doctor checks the prostate for loops or abnormality. PSA is more common test. Actually, PAA is more common first step of screening. How often should screening happen? This depends on your PSA result. Low PSA should be every 2 to 4 years. High PSA or high risk may need yearly follow-up. Okay? Whose doctor tell us this? When should screening usually stop? Many guidelines suggest stopping routine screening around age 70 to 75 or if life expectancy is less than 10 to 15 years. Because slowing growing prostate cancer may never cause harm in older age. Okay. Important note, screening is not one size fits all. Screening can save life, but it can also lead to overdiagnosis and unnecessary treatment in some men. That's why shared decision making is key. So, quick takeaway 50 average risk men. You start screening at the age of 50, those who are average risk men. Higher risk men, one close relative have a diagnosis of cancer, you should start screening at 45. A very high risk man, multiple relative genetic risk, you start screening at the age of 40. Okay, so let's talk about explain early warning signs. What are the early warning signs of prostate cancer? What are the early warning signs of prostate cancer? So totally, and it's really smart to ask because prostate cancer often starts silently and knowing the early warning sign can help catch it sooner. Okay, in the early stage, symptoms may be mild or mistakenly for non-aging or prostate enlargement. Okay, so urinary changes, most common early clue you may notice. Frequent urination, especially at night. Difficulty starting urination. Quick or slow urine stream. Feeling like the bladder does not fully empty. Pain or burning while urinating is this next common in prostate cancer. This symptom can also come from bigly prostate enlargement (BPH). Not always cancer, but they should still be checked. Okay, blood in urine or semen, pink or reddish urine, blood in semen after ejaculation. You should seek help immediately. Yet is not normal and need medical. This is not normal and need medical evaluation if you have blood in your urine. Rectal or sexual problem, early prostate cancer can sometimes cause difficulty in getting or maintaining an erection. Like I said, some certain medication, this can also be certain medication side effect, and also it can also be a large prostate enlargement can also have these symptoms. Painful ejaculation, large prostate can also have that too, and reduced sexual function. Early prostate cancer can sometimes causes this. The pelvic or lower back discomfort, which possible spread of prostate cancer. So pressure or discomfort in the pelvic, dull pain in the lower back, hip, or upper thigh. This is more concerning if it persists. Okay. Unexplained weight loss or fatigue, later warning. These are late warning of prostate cancer. Not usually an early symptom, but can occur if cancer progresses. Important note: many early prostate cancer cause no symptom at all. I've said that before. That's why screening is key. When to get checked, see doctor if you are over 50 years or over 45 with a higher risk. Have urinary symptom that does not improve, seek medical help. Have a family history of prostate cancer, you need to see medical doctor from the age of 40 if you have a family history of prostate cancer. Okay, you are of Africa or Caribbean ancestry with a higher risk with aggressive prostate cancer form. Doctor may recommend PSA blood test or digital retinal examination. Urgent sign that you must not ignore. Seek medical care soon if you have blood in your urine, severe bone pain, sudden inability to urinate. Seek medical help immediately. Okay, so for the sake of you who had just joining us, we'll recap again so that you understand what we are talking about here. Okay, we'll say that totally, and if really smart to ask, because prostate cancer can often start silently, and knowing the early warning sign can help catch it sooner. Okay, so early warning sign of prostate cancer, I would say in the early stage, symptoms may be mild or mistakenly for a normal aging or prostate enlargement. Okay, so urinary change is most common. Urinary change is most common early clue of prostate cancer. You may notice frequent urination, especially at night, difficulty starting urination, weak or slow urine stream. Okay, feeling like the bladder does not fully empty, pain or burning when urinating, which is less common. This symptom can also come from bigger prostate enlargement, begin prostate enlargement, BPH, not usually cancer, but they should be checked also. Okay, so blood in urine or semen, pink or reddish urine, blood in semen after ejaculation, you should seek medical help. And it is not normal and need medical evaluation. Yeah, you have reddish urine or pink or reddish urine and blood in your semen after ejaculation. This is not normal. You need medical evaluation. Okay, a rectal or sexual problem, early prostate cancer can sometimes cause difficulty getting or maintaining an erection. And painful ejaculation, reduced sexual function, pelvic or lower back discomfort. Some men feel pressure or discomfort in the pelvic, dull pain in the lower back, hips, or upper thigh. Here, this is more concerning if it persists. Okay, unexplained weight loss or fatigue, later warning sign, not usually an early symptom but can occur if cancer progresses. Important note, many early prostate cancer cause no symptom at all. That's why screening is key. When to get checked, we say see a doctor if you are over 50 or over 45 with a higher risk, have urinary symptom that does not improve, you have a family history of prostate cancer, you are from Africa or Caribbean ancestry, higher risk, and also more aggressive prostate cancer form, people of African descent. Doctor may recommend PSA test, digital rectal exam. Urgent sign that you must not ignore. You seek medical care soon if you have blood in your urine, severe bone pain, sudden inability to urinate. You must seek medical help immediately. So let's talk about prostate screening again for the sake of you who are just joining. We say that prostate screening. Well, we say that when should men start prostate cancer screening? We say most guidelines focus on starting a conversation with your doctor, not automatically testing everyone at this age, but age 50, average risk. Okay, age 50, average risk. So most men who have no symptoms and no strong family history should start discussing screening around age 50. Okay, this is the standard starting point for men at tropical risk. Okay, so age 45, higher risk, men should start earlier, around age 45, if they have higher risk, such as a father or brother diagnosed with prostate cancer, especially if the relative was diagnosed before age 65. Okay, average age of 40, age 40, I mean to say, age 40 is to be people who are very high risk should be screened from the age of 40. Screening discussion may begin as early as age 40 if there is a very high risk, like multiple close family member affected at a young age, no genetic mutation of a BRCA1, BRCA2 link syndrome. They could start screening from the age of 40. Strong family history across the generation. They could also start screening from the age of 40. Okay, so what does screening involve? Screening, PSA blood test. It measures the prostate specific antigen level. Okay, the digital rectal exam. A doctor check the prostate or or lobes for abnormality. PSA is more common. Is the more common first step of cancer screening. Okay. How often should screening happen? This depends on PSA result, prostate specific antigen result. Low PSA should be every 2 to 4 years. Higher PSA risk may need yearly follow-up. Okay. When should screening usually stop? Many guidelines suggest stopping routine screening around age 70 to 75, or if your life expectancy is less than 10 to 15 years, because slow growing prostate cancer may never cause harm in older age. Important note: screening is not one size fits all. Screening can save life, but it can also lead to overdiagnosis and unnecessary treatment in some men. Okay, that's why shared decision making is key. Quick takeaway: 50 average risk age; 45 higher risk men, one close family or one close relative; 40 very high risk men, multiple relative genetic risk. Okay, this is Get Well 101. While this may not constitute diagnosis or treatment, do not forget, in Gateway 101, we places emphasis on prevention because we strongly believe that prevention is better than cure. Thank you all for watching. To come your way again, stay blessed and stay protected. Stay safe. This is Gateway 101. Thank you.